Well, tonight we continue our look into solving crime in the city. With our continuing series, Wounded City, many young people deal with untreated mental illness, and there is a lack of services to help them. Medical reporter Meg Thayer is joining me now in studio with more on that. Meg?
Yes, Cherise, and before the pandemic, the state health department said more than 1/5 of people in Louisiana had mental illness. Yet only 15% got treatment, and the need, as you know, has soared. Just at LSU Health, there are 18,000 behavioral health appointments yearly, with only 63 medical professionals to see them.
This is Shrewsbury, small subdivision. He was like 1, 2, and like again, when we got married, I decided to try to get him out of this neighborhood, you know.
When Ronald Cadillac Roberts talks about his son,
This way it gets emotional, because he spent maybe 20-something years in prison out of his 40-something years of life.
he remembers early signs of problems and medication that dulled him.
We didn't know that it was a mental thing that needed to be addressed, and we didn't know. Lo and behold, that's when the trouble started.
Actor, author, and activist Amir Baraka grew up with a different type of brain disorder, dyslexia.
Had somebody caught me in the 3rd or the 4th grade, I'd have never gone to prison. I didn't like school, so I started selling dope. Most kids are going to sell dope and they're going to drop out of school if they can't read.
When kids are rejected at an early age, that's a very hard thing. They lose empathy skills and everything else if they are rejected earlier.
Chair of LSU Behavioral Health, Dr. Stephen Philippi, says that's because schools and families are crucial to mental health and emotional development.
We certainly have a good idea that if we don't early on address emotional challenges in children, some, not all, but some, may then move toward a violent response as they get older.
Dr. Ron Bailey, chair of psychiatry at LSU Health, says when stressors are added, like being away from classroom structure during the pandemic and fear from hurricanes or crime, on top of children already trying to survive serious family problems, that can lead to behavior problems.
Every school has a security officer. They should have a mental health counselor so kids can go there before a problem develops.
We know kids thrive in structure. They thrive in supportive environments that care about them. They thrive in environments where they find a purpose.
Like a family, school, sports team, band, choir, or group.
Belongingness matters to children and young adults. And if in the absence of belongingness, one certainly may, not always, but certainly may unfortunately look for that sense of belongingness in what we historically like to call gangs.
You'll notice in all these carjackings, they're not done by individual kids running around. This is groups of kids who have decided this is how we belong.
Even if you don't change thinking when they're very young, you better get them by adolescence.
And while the doctors say children and adolescents can be taught empathy and problem solving, LSU Health criminologist Dr. Peter Scharf says mental health treatment won't necessarily work if it's not geared to specific, proven programs based around moral reasoning and consequences of antisocial behavior.
We got to have better treatments and better interventions that deal with cognitive deficits, value deficits, and resistance to temptations.
While there are individual programs like Son of a Saint that connect at-risk youth with caring adults, programs, funding, and treatment are very limited.
And what I don't see is systemically all of these organizations working together better with the city.
And programs are also needed for those imprisoned.
How do we build that transition? And the current system isn't doing that. All it's doing is locking them up. And they're going to come back very unskilled, very unprepared for it.
Whenever he's released, it's understood that he needs help, and hopefully we can find some help for him.
I want people to be screened and remediated in the school systems and not in prison like I was. Why does a kid have to be diagnosed in a prison opposed to being diagnosed in a school?
And just as students get a physical to play a sport, doctors say it would make sense early on for all students to get a mental screening. Now, to be clear, doctors say there are a lot of people who commit extreme violence who do have a mental health condition, but they want to make it clear that mental health conditions are not always the cause of violence. Sharice.
Meg, thank you so much for that report.